Hello, my name is Karen. I'm a nurse specialist for the Lung Defence Service at Papworth Hospital. These video guides have been designed to help patients self-administer intravenous antibiotics at home. Being able to self-administer IV antibiotics in the comfort of your own home offers you freedom and flexibility. The nursing team will train you in all aspects of administering your treatment at home, or in some cases they can train a relative or carer. These videos are to complement the training you've already received from your nursing team. In some cases the processes may vary. If you're unclear of any of the processes and need more information, please contact your nursing team. They are there to offer you support, guidance and advice whenever you need it.
This is Ryan, who, step by step, will show you how to confidently and safely prepare and give your IV antibiotic. When preparing and giving your IV antibiotics, it is crucial to reduce the risk of infection. Use a plastic tray to prepare your IVs on. Give your work surface a good clean using disinfectant wipes or a disinfectant spray with a clean paper towel. Make sure you clean it thoroughly. Now wash your hands using soap and water. Follow the 6 stages of hand washing we showed you. When finished, turn off the tap. Do not use your hands so they stay clean, and then dry them thoroughly with a paper towel. After removing the medication from the fridge as instructed by your nurse, you need to check it. First, remove the sodium chloride flush from its package. Discard the packaging. Now carefully read the label. Is it the right medication? Check the expiry date. Now remove the antibiotic syringe from its packaging and do the same checks. Is it the right medication? Check the expiry date. Place the medication down in the order you'll use it. Finally, do the same checks with the heparin flush. If everything is okay, place 2 alcohol wipes at either end of the tray. Next, you must check there are no air bubbles in your syringes. First, with the sodium chloride flush syringe, twist the cap. Push in the plunger and break the seal. When the fluid reaches the top, air is expelled. Now close the cap. Do the same with the antibiotic syringe. Remove the protective cap and push the plunger. You should see a tiny drop of fluid at the tip when all the air is gone. Now, using the non-touch technique we showed you, screw the cap back on. Repeat the process with the heparin flush syringe. That's it, preparation is done, but before you give it, remember you must now wash your hands again. For the next stage, you can move to somewhere you feel more comfortable. An armchair will do. Remember to have your sharp spin close by. Next, roll off your bandage and unfold the gauze freeing up the bionectar inside. But before you proceed, you need to check around the venous access line. Look for signs of infection, including redness, swelling. Is the area tender? If so, tell us as soon as possible and do not under any circumstances give your medication. But if everything is okay, carry on. It's very important that you first clean your bionectar. Taking an alcohol wipe, clean the end thoroughly for 20 seconds. Then let it dry for 30 seconds. Now we need to flush the line. Pick up your sodium chloride flush syringe and remove the cap, making sure you do not touch the end. Now attach it to the bionectar. Next, slide open the clip on the line and slowly push the plunger to inject the amount of flush you've been shown. Once done, remove the syringe. Screw the protective cap back on. Pop it back on the tray, keeping hold of the bionectar with your free hand. Now do the same with the antibiotic syringe. Twist off the cap. Attach it. And slowly push in the plunger, giving the antibiotic at the rate you've been trained. When the syringe is empty, disconnect it and throw it in your sharps bin. Once finished, you must now flush the line twice. Attach the sodium chloride flush syringe, push in the plunger and give all the remaining flush. Disconnect it and place the empty syringe in your sharps bin. Now remove the protective cap from the heparin flush and attach the syringe to the bionectar and begin to give the flush. The next bit is very important. As the plunger almost reaches the end, take hold of the clamp and start to close it, whilst continuing to push the plunger. When the flush is finished, only then close the clamp completely. Now, disconnect the syringe and place it in the sharps bin. This technique prevents the line from becoming blocked. Now, using an alcohol wipe, you need to again clean the bionectar for 20 seconds. Then, wrap the line back in the gauze as you've been taught. And roll up the bandage. Tidy away the empty bottles and caps, and that's it. You've given your antibiotic. Well done. But don't forget, afterwards, always wash your hands.